Hello, dear students. In this video, I shall be discussing about different stages of chronic otitis media mucosal disease or chronic suppurative otitis media tubotympanic disease. Staging of chronic otitis media mucosal disease is very important for medical management as well as surgical treatment. When the disease is in active stage, we treat the disease medically. When the disease is in quiescent or inactive stage, surgery is indicated. And when the disease is healed, then we don't require any treatment except regular follow-up when the patient has common cold or sinusitis. So what are the different stages of chronic otitis media mucosal disease? They are active stage. The patient complains of discharge from the ear, and on examination there is ear discharge in the external artery canal and the tympanic membrane is perforated. The middle ear may be wet. That is active stage. We usually do not operate on this stage, but when the patient has severe pain, when there is impending complications, or when the discharge is not purulent, then surgery can be indicated here. When the patient does not improve with 2 weeks of antibiotics, then the patient may require cortical mastoid surgery and tympanoplasty in active stage, supposing that the patient is having quiescent mastoiditis. Next is quiescent stage. There is no ear discharge at present. There is perforation of pars tensa and last ear discharge was less than 6 months ago. That means within 6 months. The patient can undergo surgery in this stage. In active stage, there is no otorrhea. The TM perforation is still there and last ear discharge was more than 6 months ago. There is very less chance that the mid-ear will be infected. So we have to follow up these patients, and if the patient is having hearing loss, then patient requires surgery to improve the hearing and to close the perforation. Next is healed stage. That means patient is not having otorrhea for more than 6 months duration and the TM is healed. Most of the times the TM will be thin and monomeric. There will be single layer of tympanic membrane. The patient does not require any treatment for this condition, but patient has to follow up when the patient is having common cold. The thin TM may get infected and perforated. So in the exam, if you are asked regarding complete diagnosis of chronic otitis media mucosal disease, then you have to tell the patient is having right or left-sided chronic otitis media mucosal disease of certain stage, having certain amount of conductive hearing loss, having dotted degree of conductive hearing loss, may be mild, moderate or severe according to your tuning fork examination and without complications. If you like this video, please subscribe my channel Dr. Krishna Koirala for further videos like this. Thank you. Good luck.